As late summer 2025 unfolds, COVID-19 remains a persistent part of our lives, shaping daily routines and community interactions in ways both familiar and new. Even as we enjoy the warmth of the season, the presence of the virus is a constant reminder of the challenges we've faced and those that still lie ahead. From city streets to neighborhood parks, people continue to adapt, balancing caution with the desire to reconnect and move forward. The virus is evolving with each new variant, keeping scientists and healthcare workers on alert. Researchers are working tirelessly in labs and in the field, tracking changes in the virus's genetic code and monitoring how these shifts impact transmission and severity. Their efforts are crucial in helping us understand what we're up against and how best to respond. This year, a late summer surge is underway in the U.S., driven by a new dominant variant, XFG, also known as Stratus. Testing sites are once again seeing long lines as people seek answers and reassurance. The demand for rapid results and reliable information has never been higher, as communities work to stay ahead of the curve. The familiar seasonal pattern is back, coinciding with increased travel and the return to school. Airports, bus stops, and classrooms are bustling with activity, but also with a renewed sense of vigilance. Families and educators are navigating the start of the school year with a mix of hope and caution, mindful of the lessons learned from previous waves. Each new variant brings questions about how well our immunity holds up and what new challenges we face. Medical experts are closely watching for signs of increased severity or breakthrough infections, and public health officials are working to keep the public informed about the latest guidance. The conversation around boosters and updated vaccines is more important than ever. XFG's rapid rise reminds us that adaptability and reliance on scientific data are crucial. Health authorities are analyzing trends in real time, adjusting recommendations as new evidence emerges. Community leaders and scientists alike emphasize the importance of staying flexible and informed, as the situation can change quickly. Our goal is to provide clear, current information, empowering you to make informed decisions as we head into fall and winter. Whether it's understanding the latest variant, knowing when to get tested, or learning about vaccine updates, staying informed is key to protecting yourself and those around you. In the next sections, we'll break down the latest numbers, highlight the hardest-hit regions, and explain what you need to know about XFG and vaccine updates. We'll also share expert insights and practical tips to help you navigate this evolving landscape with confidence. Let's start with a look at the national numbers shaping this late summer wave and explore how communities across the country are responding to the ongoing challenges of COVID-19. To understand the current surge, let's look at the data public health officials use to track COVID-19. As of late August 2025, the national test positivity rate has climbed to 10%, up from 8.9% just weeks earlier. While this is a clear increase, it's still below last summer's peak of 18%. Experts estimate over 500,000 new infections daily, many unreported through official channels. Emergency room visits and deaths have both seen a slight uptick, with children under 12 experiencing a notable rise in ER visits. The XFG variant is affecting all age groups, not just older adults or those with pre-existing conditions. As schools reopen, vigilance and protective measures remain essential for everyone. The XFG surge isn't uniform. It's concentrated in the western and southern U.S. states like Washington, Oregon, California, Nevada, Texas, and Louisiana are reporting the highest positivity rates and wastewater signals. Even Alaska is seeing significant activity. Wastewater surveillance, now a key tool, shows high virus levels in at least 11 states, including Utah, Florida, and South Carolina. These hotspots reflect regional factors like travel, gatherings, and climate-driven indoor activity. For those in or traveling to these areas, extra precautions, like masking indoors and improving ventilation, are especially important. Knowing your local risk empowers you to help slow the spread. The XFG variant, or Stratus, has rapidly become the dominant strain in the U.S. In just weeks, it jumped from 14% to the majority of cases, thanks to its high transmissibility. XFG is a recombinant hybrid of two Omicron strains, with mutations that help it evade immunity and spread quickly. Reinfections are more common, but the World Health Organization currently assesses XFG's public health risk as low. It doesn't appear to cause more severe illness than previous Omicron variants, the main impact is a surge in cases, which can disrupt daily life and strain healthcare systems. Fortunately, vaccines and treatments remain effective at preventing severe outcomes. Staying up to date on vaccination is still our best defense. XFG was first detected in Southeast Asia in January 2025, emerging from a rare co-infection of two Omicron subvariants. Scientists believe that crowded urban environments and high rates of travel in the region created the perfect conditions for this hybrid strain to develop. The initial cases were quickly identified thanks to robust local surveillance, but the variant's unique genetic makeup soon set it apart from previous strains. Its distinctive mutations gave XFG a significant competitive edge, allowing it to spread rapidly across borders. International travel played a crucial role, as travelers unknowingly carried the virus to new regions. Within weeks, cases began appearing in major cities around the world, highlighting just how interconnected our global community has become. By August, XFG had become the dominant strain in the United States and was confirmed in at least 38 countries. Health authorities tracked its progress using advanced mapping tools, watching as the variant quickly outpaced others and established itself as the primary driver of new infections. Genomic sequencing and wastewater surveillance provided critical evidence of XFG's overwhelming presence. In some regions, up to 82% of wastewater samples now contain traces of the variant, offering a real-time snapshot of its rapid spread and dominance in communities. The variant's swift rise is a stark reminder of the virus's relentless evolution. Public health officials are racing to adapt, emphasizing the need for nimble strategies that can respond to new threats as they emerge. Each new dominant variant is the result of a race to spread more efficiently, with XFG now leading the way. Its ability to move quickly through populations has challenged existing containment measures and forced a reevaluation of current protocols. XFG's success is largely due to its ability to bypass immune defenses, infecting even those who have been previously vaccinated or recovered from earlier variants. This has led to renewed calls for booster shots and updated vaccines. The ongoing evolution of the virus underscores the importance of adaptive vaccine development and continued vigilance. As XFG continues to spread, scientists and public health experts are working tirelessly to stay one step ahead, protecting communities and preparing for whatever comes next. XFG's symptoms are similar to previous Omicron subvariants, mainly upper respiratory issues. Common symptoms include a severe sore throat, persistent cough, congestion, runny nose, fever, fatigue, headache, and body aches. These can easily be mistaken for a cold or flu, so testing is the only way to confirm COVID-19. Most cases are mild to moderate, but watch for emergency warning signs: trouble breathing, chest pain, confusion, or inability to stay awake. Severity varies by age, vaccination status, and health conditions. Listen to your body, rest if unwell, and seek medical care if symptoms worsen. Stay alert, especially if you're in a high-risk group. Vaccination remains our strongest tool against XFG. The 2024-2025 COVID-19 vaccines are safe and effective, especially at preventing severe illness and hospitalization. Because XFG is an Omicron variant, current vaccines still offer strong protection. The CDC recommends staying up to date on vaccinations, with an extra booster for those at higher risk: adults 65 plus, immunocompromised individuals, and those with certain health conditions. The American Academy of Pediatrics urges vaccination for all children 6 months to 2 years, especially as ER visits among kids rise. Updated vaccines targeting new strains are in development for fall 2025. These next-generation shots will better match circulating variants, enhancing protection for the coming respiratory virus season. Staying current with vaccines is key to reducing risk. COVID-19 tracking has evolved with less frequent updates and more reliance on new data sources. With more at-home testing, fewer cases are confirmed by PCR and sequenced, making real-time variant tracking harder. Wastewater surveillance now provides the most comprehensive view of community spread, capturing trends even before clinical data shows a rise. Instead of daily case counts, focus on test positivity, ER visits, hospitalizations, and wastewater levels for a clearer picture. The CDC now tracks weekly trends for more stable analysis. This shift doesn't mean the threat is gone, just that our surveillance is adapting to be more sustainable. By watching these key indicators, we can make informed decisions as the situation evolves. The recent XFG-driven surge is a powerful reminder that COVID-19 is no longer a distant threat, but a recurring part of our yearly lives. As new variants emerge and case numbers fluctuate, it's clear that the virus will continue to shape our routines and decisions for the foreseeable future. This evolving landscape calls for a renewed sense of awareness and responsibility from all of us. Ongoing awareness and adaptability are essential to protect ourselves, our loved ones, and our broader communities. By staying alert and flexible, we can respond quickly to changes in local risk and help those around us do the same. Supporting one another, whether by sharing information, offering help, or simply checking in, strengthens our collective resilience. Staying informed is more important than ever. Turn to reliable sources like the CDC, your local health department, and trusted medical professionals for the latest updates. Avoid misinformation and rumors that can spread confusion or fear. Instead, focus on data-driven guidance that empowers you to make smart choices for yourself and your family. Pay attention to local trends, such as wastewater surveillance data, hospitalization rates, and public health advisories. These indicators can help you decide when to take extra precautions, like masking in crowded places or avoiding large gatherings during surges. Being proactive allows you to stay ahead of the curve and minimize your risk. Vaccination remains the cornerstone of our defense against COVID-19. Current and upcoming vaccines are designed to offer robust protection, especially against severe illness and hospitalization. Getting vaccinated not only protects you, but also helps shield those who are more vulnerable in your community. Staying up to date on your boosters is a simple, effective way to maintain your immunity and reduce the strain on our healthcare systems. Even if you've had COVID-19 before, boosters can enhance your protection against new variants and help prevent future outbreaks. We now have the tools, knowledge, and experience to manage COVID-19 risks in our daily lives. By staying informed, following public health advice, and making thoughtful choices, we can continue to enjoy life while keeping ourselves and others safe. Confidence comes from preparation and shared responsibility. Our collective commitment to vigilance, adaptability, and sensible precautions will keep us safe as the virus continues to evolve. Together, we can navigate this changing landscape and look forward to a healthier, more resilient future.